All right, so that encompasses all the anatomy of this chapter. We'll start looking at it on x-rays as well as we move on. Before we do that, we're going to talk about gender differences in pelvic anatomy. Of course, there are clear differences amongst the genders because what do the females have to do? They have to
We gotta give y'all babies.
deliver some babies, right?
We gotta give y'all back.
They got to deliver some babies. So, we're going to talk about those different characteristics because, as you can already see by the diagrams, clearly we have a pathway here, but not so much here because of how that anatomy sits with the gender differences. Now, there are some different points that we're going to name of clear differences. Now, this is really big registered material, by the way, guys. When it comes to gender differences, they're going to ask you a question. They're going to have a male and female pelvis side by side and ask you to label either or, which one is which, or what are the differences between the male and female pelvises. Now, right off the bat, if you're just glancing at those two images, female on the left, male on the right, what's the clearest differences you can see?
The big circle.
The oval.
The big circle.
The sacrum.
Sacrum's
What's
pushed
the big
back
circle
or
called?
something.
The brams of the
Brim of the pelvis. That's the first big difference we notice. The brim of the pelvis for females is more what? Wide, like a sideways oval, versus the male is more of a what? More of a vertical oval. That's the first difference. What's the second thing you see?
The cocks or the
Sacrum's like
The what?
far
The
back.
sacrum is
The sacrum and the what?
cocks.
Coccyx. Sacrum and coccyx are situated differently. So for females, where's my spine at? You're embracing that spine. This is a male pelvis, by the way. And the reason I know is because if you look at the sacrum and coccyx with the pelvis, see how it's curving inward? Now, if you had a baby going through there, what would happen?
baby.
It's going to get its head scraped up, right? So for females, the sacrum and coccyx actually sits more posterior, allows that baby to pass that birth canal a lot easier. Versus male is going to curve more anterior. So that's the second big difference. What else do you see?
The oval.
What about the pubic symphysis?
And a female, it's more.
You want your spine back?
And male, it's more together.
Very good. The area of the pubic symphysis is shaped differently. For males, it's more what we call acute or sharp. For females, it's more obtuse or wide. That's the three main differences between the male and female pelvis. We're going to look at those a little closer as we move on. All right, so of course we also have what's called the inlet and the outlet. You're going to see these terms thrown around here, guys, when it comes to the pelvis. When we talk about the inlet portion of the pelvis, and this is something we base a certain position on, we do what's called an inlet and outlet view. This area of the brim is the inlet. The area here by the pubic symphysis, where that triangle is the outlet. So inlet, outlet. Kind of makes sense, right? Inside the pelvis, outside the pelvis. Inlet versus outlet. Also showing you, of course, this is how the female sacrum and coccyx is going to be situated. It's going to be more posterior, allowing for that natural birth to occur more easily for a female. And this would be an example of a female pelvis that we see right here, guys. That's a lateral view. You see that sacrum and coccyx more posterior. For males, it's going to be more like this, curving into it right here. Yes?
I don't know if you mentioned this already, but are females more prone to breaking their tailbone or coccyx?
Not exactly.
No?
I think so. That hurts, by the way. If you ever break your...
Yeah.
By the way, don't ever call it a tailbone again. We don't use those layman's terms around here. It's a
Did you
coccyx.
point to your thigh?
I did. Hypocrite, right? Yes, tailbone is the coccyx. I'm not going to call it tailbone, though. So that's showing you right there just a couple of ooh, that's a bad x-ray. That's very blurry. Sometimes we do x-rays with the baby inside the belly for emergency purposes. Can you see where the baby is? Can you see how the baby is lying? See how the head is down here in that pelvic brim? Typically, that's how they're going to lie for a natural birth. If it's upside down with the feet downwards, what we call a breech birth. That's what we do not want to occur. It can cause a lot of complications for the female. Of course, depending on the size of the female, you know, my wife was very tiny. They had to do a 4th-degree episiotomy to get the baby out. She was so small.
What is that? Where they cut you?
They cut you to make space for the baby to pass through, because they really did not want to do a C-section on her because of her heart issues. I still got to tell you that story. I still haven't told you that story. Yeah, don't let me forget that before the semester's over.
Ariel's birth, right?
Ariel's birth. Of course, if it's just impossible for the child to pass through naturally, they'll do C-section. Get the baby out there to, prevent the baby from getting lodged in there, possibly passing, and of course, the mother suffering from further complications as well. Just a couple more pictures there. I always thought it looked like an alien. You ever see aliens when they burst out of your chest? Looks like aliens, right? Or that'd be a MRI image you see right here. It's a sagittal MRI image I'm looking at here. So yeah, most of the time the child does sit in the belly upside down. It's also why when they kick you, it feels like they're breaking your ribs, right? You know what I'm talking about? My wife always felt like her ribs were being cracked.
Yeah.
Because Ariel was a kicker. Yes.
Yeah, they're really
And then we have some babies that look like this. Now look at this female patient here. We got some major issues with this female. Do you want to figure out what kind of disease this patient has?
Where are her hips?
She's missing.
Confused. One's goes to the
Look at
diaphragm.
her
I'm so
pelvis.
confused.
Let's look at her arms. We have an extreme deformity here. Extreme pathological condition. You might know what this is.
That's what do they call that in Attack on Titan? The giantism?
That's
Is this the same thing as
It's a very deformed pregnant female, as you can see.
I feel like this is the tiny lady.
The humerus is wild.
Mm-hmm.
This is not human.
Thank you for saying that, because
Oh, for real?
I'm sorry, I'm trolling y'all.
Oh,
I just wanted to see
I was
if
gonna say,
anybody was going
that's-
to recognize this wasn't a human.
And then
That skull is like crazy, man. I was like, geez,
I was
it's
just
all
like, wait a minute,
kinds
this
of
don't even look
twisted.
human.
Does anybody know what this
That's
is?
the
That's a
Antichrist.
bird.
A bird.
It
Oh,
does look like a bird.
No, that's a bird. You're right.
it is? Oh, let's say that's a bird.
No.
That's a mixture of a bat.
What?
That's a pregnant bat.
Oh, well, I was close. A bird.
I had y'all going for a while though, right?
I was just
Oh,
like,
come on, I
That's
tricked
pretty
some of
weird.
y'all. I tricked some of y'all.
Yeah,
You got me.
I was like,
I thought I was looking at the Antichrist. I was like, what the fuck is going on?
But it's kind of fun to look at, because a bat is a mammal. If you were to collimate that, it almost looked like a human chest X-ray.
yeah.
You can see the wings and everything down here, that narrow pelvis. That's a really narrow pelvis.
I sent you a video last night, didn't I?
Huh?
The baby.
That baby.
Yeah. I was like, what? The baby.
Look at that electron process stuff.
Oh yeah, that's
That's a
right.
nice one.
Got nice baby down there.
So, are they externally rotated? That looks like they're AP.
I mean, bat wings, I don't know.
I can't help you with that.
Wait, what?
Is that actual thing?
I got some of y'all. Okay, come on. I
Yeah,
got some.
that's
All right, so
that's an endangered like.
once again, guys, make sure you know your bat anatomy for your test. It's very important. Yes,
Do they have like animal x-rays?
they do. They have veterinary X-rays.
Yeah. You can get a
That
job.
would be fun. Yeah.
I think there's some extra schooling for that, yes, but you can do X-rays on animals.
That would, I wouldn't do that.
I put the dog to sleep quick. Come on.
Sure.
Get that X-ray and go on. Wake up. Come on.
Because they won't understand. You can't communicate.
You know that meme?
All right, guys, so once again, make sure that you know the three main differences, that being the general shape of the pelvis, the angle of that pubic arch, and the shape of that inlet, three biggest indicators. When we say the inlet, once again, guys, we're talking these angles right here by the pubic symphysis. Females, obtuse, males, acute. So the male pelvis is a lot cuter than the females. It's a very cute angle. That's not me, that's science. I didn't name it that way. Females are just so obtuse. That's not me, it's science.
Stop right there.
What did I say? I say inlet?
Yeah, it says.
That's outlet.
It
I'm
says
sorry.
inlet.
I'm sorry. The shape of the inlet would be this area here, guys. This would be the outlet. I apologize. Outlet is the outside portion. Inlet is the interior portion where the brim is, where the child would sit in the belly. inlet versus outlet. I'm laughing at my jokes again. I'm so offended. All right, so we're gonna be side by side, guys. Now be careful. I want you to look very closely at these two images because sometimes looks can be deceiving. Which one's male and which one's female?
A is female.
How do you know that's female?
Cause I'm looking at the mask you said it remind me of.
Looking at the outlets.
Yes, that's what I'm
Very
looking at.
good, Shameka. So I'm glad you said that because our first assumption would be looking at the inlet. Look how vertical and oval it is. That's usually characteristic of the male pelvis. So what's going on here? This is an example of an angled X-ray. This is an inlet
that's it.
view, what we call an inlet view X-ray, where we stretch this out for a better view.
Yeah.
So you gotta be careful. We can't look at one part, we gotta look at all three aspects when we identify male versus female. Because you looked down here at the outlet, you saw how wide and obtuse it was, yes? So that's that big indication. Probably the best indicator is that outlet between male and female. This would be a male, but once again, we can't really depend on the brim because look how wide the brim looks. But if we look at the outlet, there's that acute angle, but also with male patients, we always can see well, not always, we can often see a shield here. Because you're not gonna shield a female patient for a pelvis unless you have a very special shield that goes right here. If you see a shield down here, that's usually a clear indication you have a male patient. Another little clue. Huh? Because where are the ovaries located? Think about where your ovaries are. They're about right here. Now there is a specialized female shield they can request. Not all facilities have them. It's an ovarian shield, but you have to situate it just right. It's very difficult. I've used these before. You have to put it in the exact location right here. Otherwise, you're going to cover up the anatomy and have to repeat and overexpose them anyway. So lots of it's just safer just to do one X-ray without having to risk repeating. Make sense? Yeah.
So for a female that's more obtuse, whenever they're children, is it still obtuse? Or
Yes.
like, does it get
You
bigger?
can see it in children as well, typically. Now, all the bones aren't fused all the way on children. And funny enough, on a pediatric X-ray, these are the portions that usually aren't fused yet. It look like two little claws right here, two little C's. There'll be an open spot here and here. So you won't really be able to see that full outlet formed yet, but you can see it starting to take shape as they get older.
On a male view, it reminds me of like a heart.
What's that?
The inside image, it reminds me of like a heart.
It does kind of look like a heart.
Yeah, that's how I kind of.
And likely, this patient came in for pelvis pain, but the reality is he just needs to go to the bathroom.
It's right there.
A lot of times when you get constipation, it can cause a lot of pain in that area. A lot of your pelvis patients will just need to go potty and go to the bathroom. It's need a laxative. Full of it. They're literally full of it. Yeah. So there, once again, guys, normally that brim is going to be more vertical in shape for males. There's that acute angle on the outlet. Females more wide, more obtuse on the outlets. Y'all seeing that? Making sense? You can't always depend on a shield because, you know, we got some sloppy techs that don't shield. But you can usually see the male organs as well on pelvis x-rays, honestly. Usually, you can see male and female organs depending on how low they centered. That's a little indicator as well. But don't always depend on that because if you feel very tight on that collimation like me, you gotta look closer. Oh, hey, no, I'm all about that tight collimation. If you work pediatrics, it's required. You have to.
Yeah, but that's so close to the, you might cut the pubic symphysis, so.
That's why you gotta be good.
Oh.
That's why you gotta do what you do. Get that X-ray vision. One more example there, guys. There's those angles of the outlet versus the inlet. Glance at those once again without the lines and dotted lines. Would you be able to see the difference? Yes, make sure you can. You're gonna see questions from me on that and your registry. So, and once again, you know, I mean, you can see the male anatomy here, but don't always depend on that.
I have a question.
Yeah.
You can also see the sacrum and the coccyx.
Not as clear. So we know there's a difference with the sacrum and coccyx, but because of the way we're doing an AP pelvis, we're not really gonna be able to see the angle of it very well, unless we're doing like a lateral view. So you can't really depend on that. That is a difference, but not something we can really see on the X-ray. Good point to bring up, by the way.
Is it common to burn out the alley?
Is it what?
Is it common to burn out the alley? Like the
No, it's just that's a poor technique. Yeah, and actually this person's cutting the iliac crest off too. See that? This person's centered too low. This person's centered too low on this x-ray. This is better centered here.
So that's a film, right?
Is that film?
It says 1994. 3/24/92.
Oh yeah.
It likely is. I was in 4th grade.
Or was it a box?
Yeah.
It wasn't a problem. Rub it in, why don't you? All right, so one more here, guys. Which one's male? Which one's female?
Female's A, male's female.
But why? Defend the answer. Why is A female? Because of what? Not the pubic symphysis. The outlet is obtuse. The one on the right is male because the outlet is acute. How about the brims? Well, they almost look the same. So you can't always rely on that once again. So once again, guys, the clearest indicator is that outlet of the 3 differences. All right, so localizing anatomy, guys, this is just some palpation points, but please, for the sake of humanity, do not use all these as palpation points. I don't think I need to go into detail why. Iliac crest and as is gas, we use this for abdomen and other hip x-rays that you're going to learn this week. Please do not palpate your patient's pubic symphysis, even though the books still label that as a palpation point. I think I told you I had a tech I worked with that still did that. She was this elderly lady. She would always go in there and just palpate pubic symphysis, and she'd just stick her hand down there and just like, oh my God. Like, I mean, yeah, I'm not going to fly these days. Don't do that. Greater trochanter, we can. Everybody. Yeah, young and old. She just got her hand in there. She didn't care. She's been doing it for 3,000 years. She was done caring. Greater trochanters is a good one, guys. Greater trochanters are very important, and we can palpate them. If you put your hand on the side of your hip and move your foot around, you can feel that greater trochanter shifting. That's a very important landmark because the greater trochanter is in line with the pubic symphysis. So if we need to center the pubic symphysis or need to know where it's at, we can palpate the trochanter instead of the patient's symphysis because it lines up with it perfectly. Ischial tuberosity, another palpation point. I don't think I need to say why you don't want to palpate there either. Just don't do it. And tip of coccyx, you know, if you're brave, you can palpate that coccyx. I wouldn't recommend it. That same tech I was talking about, she used to get her hand in there too on those patient coccyxes. And yeah. No, thank you.
She
No,
did not
thank you.
care if she got
But that's
the
considered a
opportunity.
palpation point as well. Yeah, I'm not brave enough for that. No. Sorry. All right, so that's what I was just saying, guys, in red. That is a question as well. Make sure you know that. Most prominent point of that greater trochanter, which we can feel inside of our hip, is in the same horizontal plane as the pubic symphysis. So we can use that to localize that pubic symphysis if we need to center there for any reason. And some x-rays we'll learn do require that, namely the inlet and outlet views that we're going to go over later on. And so everybody just wants to get pubic symphysis better because that's actually a common fracture point for wrecks. When people get in car wrecks, the pubic symphysis will separate, which as you can imagine will be very, very painful. Some traumatic births cause the pubic symphysis to separate as well. If it's a very large baby and they don't do a C-section, it can actually break open that pubic symphysis. I'll show you, I got some pictures. It's a very complicated surgery. Yeah, they got some big babies out there.
Growth hormones and food.
Like all of us, we were 6 pounds, and my sister had.
Ariel was tiny. Ariel was like, I think she was like just under 5 pounds. She was like,
She's like, it's because their dad is 6'4", and I'm like, no, it's because we weigh a lot.
so, what do we have here? Hey, that's what we're doing.
Female.
Review.
That's a female.
Oh, very good. I didn't even ask that yet. Very good. How do you know it's a female?
Obtuse angle.
Obtuse angle. Obtuse angle. But let's see what we can name on this x-ray, guys. We've got some really great anatomy. This is a case point gold star image. You will have one of these on your registry. This is one of the things they will have you label. Any of these letters that we see on there. Let's start with letter A. We should all know what letter A is, guys. What is that? So which one?
The left.
The left.
Make sure you're careful with those left and rights again, guys. Anatomic position. Left iliac crest. What is letter B?
Aces.
The as is. Very good. The as is letter B. As is.
So what would the posterior one be? Down.
I'm gonna show you in a second.
Yeah, because you
It's
said
not
you was
labeled.
gonna,
It's
yeah.
not labeled. What would, let's see. So what would letter C be? C and D are actually the same thing.
Superior.
I want to show you how this varies. C and D are both pointing the same thing. Ischial ramus or ischial tuberosity. So when you're labeling it ischial tuberosity or ramus, it's this range right here, guys. Now, to be safe, what I would always do is put it closer towards the femur, right here. Don't put it down here, because that's where that line is. Remember dividing the two? Inferior ramus, tuberosity, ischial tuberosity. So I'll put it right here every time to be safe. That's me. So C and D, they're both pointing the same thing. Ischial ramus or ischial tuberosity, the left one, by the way. What is letter E pointing at, guys? Pubic symphysis. F is referring to a region. What region is F pointing to? Just the pubis. So if you see an arrow in the middle here, guys, that's just referring to the pubis. But if this arrow was down here, what would it be? Inferior ramus. So what would letter G be? Superior ramus. Y'all seeing that? Superior ramus, pubis, inferior ramus, and what is that again? Ischial tuberosity or ischial ramus. Now here's, you might have to look on the TV screens for this one. It's a little hard to see on here. What is H pointing to?
Great. Psychotic. I mean,
Psychotic.
I mean, not psychotic. No, that's
Not the sciatic notch. It's that little point.
The point, yeah.
Ischial spine.
Ischial spine. That's the ischial spine. You can barely see it. Some of it is more prominent on other people. But y'all see it coming out right here? That's your ischial spines. TVs are a little easier to see. What is letter J pointing to?
Neck.
the lesser.
That's the coronal neck. L is referring to this round area. What is that? The head. K is also referring to the neck, by the way. What would this be?
Greater.
Rare trochanter. What would this be?
Lesser.
What is that line going through there?
Interterritorial line.
Blah, 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 blah. What? We're mumbling that one. Intertrochanteric crest. Intertrochanteric crest. In between the two trochanters. What is I? Something like that socket, by the way. The capitalist.
So be a capitis.
No. So it's talking about this slot here. That's the acetabulum. Fovea capitis, very hard to see. It's right here and here. Can't always see it on every x-ray. Watch that arrow and be careful because as you see, it's a very thin part to label. A very important piece of anatomy, that acetabulum. It's that joint space you see right there. Acetabulum.
Even though it's pointing at the femur cell, not in the bone.
Correct. Correct.
So this is not putting up the joint space in between?
So that's the acetabular space that we're pointing at right there. Here and here. Yeah. What is elm? The ala. The ala. The ala. What portion of the hip bone is this? Ilium. What portion of the hip bone is this? Ischium. And this? Pubis. What's this round edge called? Pelvic brim. What is this portion here that's wide called? Pelvic outlet. Now, by the way, pelvic brim is synonymous with pelvic inlet. Okay. What is that bone there called? Sacrum. What's that tailbone called, Jen? Coccyx. Coccyx. You didn't hear me?
That's how I was yesterday. I was like,
What's this joint here called, ladies and gentlemen? What are these joints called? SI joints or sacroiliac joints? Now, when you said, where's the PSIS and PIIS? Very hard to see on an X-ray, we can barely make it out. If you look closely here, I'm gonna trace this dot down to this first point right here. Y'all see that?
Okay. Like a nose.
That's the PSIS here.
Oh,
Here.
that's like a nose.
It does look like a
That's
nose.
like a no, yeah.
And then this little ridge here is the PIIS.
Oh, okay.
So they're the connection points of those SI
That's
joints,
not bad.
essentially.
Okay.
Where's the sciatic nerve?
You cannot see it on this X-ray. Good question.
Is there a view that you can, or? it's
You
not a
can
little-
sometimes see it on a Donahue Miller, but not commonly. More so, you're just gonna label it on a diagram, not on an X-ray. There's actually less to label on an X-ray, which is the diagrams. That's a good thing. Let's look a little closer here, guys. That's that fovea capitis. Some of y'all are wondering where that fovea capitis is. Do you see it now? That little hole. And look, we can see really closely here, guys. There's your acetabulum. Y'all see it?
Yes.
There's your head of your femur. They both come together to make the hip joints. Fovea capitis. There's your neck, greater trochanter, lesser trochanter, and then there's that intertrochanteric crest, which you can't really see very well on this one. By the way, what is this again? Ischial tuberosity. I'm naming that one a lot because that's one of the favorite ones to have your label right there. Ischial tuberosity. Oh, I didn't ask what this was. Let me go back a second. What are these two little things called?
Orbiter foramina.
Obturator foramina.
Obturator. You said obturator.
Obturator foramina.
Obturator.
Obturator. And what is this right here?
Pubic
Pubic symphysis.
And that's a female.
It's not too bad. It's not too bad, right? Not too bad.
Wait,
I'm gonna give y'all some practice sheets, don't worry.
So Eva is the pubic symphysis or the gap was.
It's just the pubic symphysis right here.
Mr. Donahue,
Yeah.
is there a joint in that guy?
Is there a what?
A joint
Joint for
or
what?
a cavity in the pubic symphysis?
It is a joint. Pubic symphysis is a joint. It's
Oh,
called
that's a joint.
cartilaginous
Oh.
joint. Yeah. When you say pubic symphysis, you're simply naming the joints.
Joint.
Now, you give up. This is what we call a lateral femur or lateral hip, also called the fabled Donahue Miller, which will be your least favorite X-ray you do tomorrow in lab. It's a cross-table exam when you come in with a trauma case and the patient's femur is broken and cannot manipulate it. You're gonna shoot cross-table. So what are we looking at
This one,
here?
right?
Well, look closely. Just look closely, very closely, and you can start making this stuff out. Let's start with letter A. What do y'all think A is talking about? That's the acetabulum. You'll see the head of the femur finish there? That's your acetabulum. D would be what, guys? Head. So C is what?
The neck.
Neck. We'll go down to G, 'cause that's that really important one again. Let me go back and forth here. Look at previously. Ischial tuberosity, head of femur. Head of femur, ischial tuberosity. Y'all see it? It's that ischial tuberosity for letter G. Now, let's go to letter D. What would that be?
The body.
Body or shaft. But let's go to the tough ones. What do you think letter F is? Very good. That is the greater trochanter. Now, the greater trochanter on the lateral view, you'll see on both sides. It's a very large protrusion. The lesser trochanter will superimpose, so we can't see it. But the greater trochanter you'll see on both sides. Only on the Donahue Miller here, by the way, guys. Versus if you're looking at just AP, we go back. There's the greater. There's a lesser. This is very large, so when we look at it from a lateral view, we're going to see it on both sides. Make sense? By the way, what is that round thing?
The brain of the pelvis.
Just the pelvic realm, or the inlet. Yes.
How is the patient positioned for this? I think that
Like
was also
Chester?
visualized.
How's the patient? So the patient is laying flat on their back. So if my right leg is broke, or my right hip is broke, right femur, whatever's broke, I'm going to lift the unaffected leg up and shoot between the legs cross table.
Like the transthoracic.
Similar, but not through anything. It's going to be isolated. You're just going to get the leg out
Oh,
of the way
okay.
and
Out the
shoot.
way and shoot right there.
Like
You'll
Chester
see
is the
tomorrow.
front.
You'll see tomorrow.
Oh, you're gonna
Isn't
shoot like
Chester good?
this,
Huh?
like we did with
What is E? E is a lesser trochanter, just superimposed.
that's what you're gonna do.
Mr. Donahue,
Yeah,
isn't Chester doing it up there? The
Huh?
position?
sort of.
Yeah, kind of. Like,
Sort
I
of.
thought that's what she chose it for.
I didn't even think about that. That's kind of true. There it is outlined for you guys. That's a little easier. When in doubt, draw you some pictures, guys. This is a reverse view, by the way.
I already got it.
There's the graders coming out on both sides. Lesser is superimposed. There's your neck, your head, your tuberosity, and your acetabulum. You see a little more there? Another gold star image, by the way, guys, at Cornelius Miller. Very important X-ray to know every in, out, and around, about. The trauma view, the trauma X-ray.
Asking them to lift their leg on the trauma X-ray?
You're lifting the unaffected leg.
Unaffected, okay.
You know how
I'll
we
show you
did
what I'm
that,
talking about.
Jay, you know how we did the.
I know it's not what's bothering me.
Yeah.
And it's like that's what basically what they done, raise the affected leg out the way. So
What if they, so if they broke both of their, like their pelvis, like on both sides, then they wouldn't do this. Yeah, they wouldn't be able to do this. So, we getting another pencil view?
Yeah.
Love it.
So.
So she had a fracture and she was skinny.
Don't make fun of my toes.
And TK. What is that?
So.
What is that?
You'll see some.
Do they have a name?
So, if this is the leg that's broke.
Uh-oh,
this is the
careful now.
Femur is broke.
The ball?
Don't make fun of my drawings. So this leg is broke. You're gonna raise the unaffected leg up, and you're gonna shoot cross table on the leg is down. You lay on the back. It sets back here, and you shoot across. Leave the femur in there. Make sense?
It does, but that guy.
Y'all gonna hurt my feelings. I really feel like I'm
So
working
it
on
has to
drawings.
be medial, it has to be like medial lateral projection?
Yes.
Is that where we're bringing up the
Yes,
leg?
correct.
So
You're gonna
otherwise
shoot
we can
into
do
the
lateral.
joint. You're gonna shoot into the joint. The what? Oh, you'll see.
Probably the.
It's everyone's least favorite X-ray, but it looks quite beautiful when you do it right.
Is that one that?
Imagine just have to do something.
There's one more, huh? Yes,
Yes.
that's a
So what if
mandatory.
we don't get that at all?
That's not
Do
mandatory.
Well,
is it a?
We'll always see
Simulated.
next year.
Huh?
We'll always see with the next cohort.
I know, but say if we don't get it at all.
Yeah.
You can simulate it.
Yes,
There's
that's what I was,
simulation
yeah,
options,
okay.
yes.
Do you have there been like three hundred
We can
Huh? That means that I think we.
Because a lot of techs,
You do
a
it in
lot
the
of techs are
test
intimidated by this X-ray. It's really not that bad. I used to do these all the time on kids, because kids break their legs all the time. On trampolines and monkey bars, we would get these all the time. It's a beautiful X-ray, we learn how to do it. It's not as serious as it looks, but techs are freaked out by it for some reason. They hate doing it.
So if you have a tech that doesn't want to do it, like, oh, I'm doing it, I'm gonna do it.
Pretty
You gonna
much.
take him home? Might be a dinosaur.
That's what I
All
Like a
right,
dinosaur.
review question. Which palpable landmark is at the same level as the pubic symphysis?
The greater trochanter.
The greater trochanter, correct. Which of the following compose the hip bone?
These and dogs.
Y'all said D?
It's a dog.
No.
You said hip bone?
Why is that incorrect?
Because the hip bone's only the.
Because ilium doesn't.
This is me being super sneaky.
Oh.
We have another ilium in the body.
Yeah, oh yeah. You wrong.
You spelled ilium
I
wrong.
mean, yeah, he said it wrong. I mean, it sounds the same.
Where have we talked about iliums before?
The abdominal.
Abdominal.
The last portion of the small intestine is called the ilium with an E.
Yep, that's what.
Hip is ilium with an I.
Mm-hmm.
That is so wrong.
Yeah.
I know that's, okay, let me say something, guys. Let me say something.
Yeah.
Let me say something.
That's what-
This is where you gotta be careful, because this is what the registry is gonna do to you right here. When they wanna be really evil, that's what they're gonna do right there. That's sick and twisted, but that's what they're gonna do. Make note, there are two iliums, so I'm gonna do this on your test. So I would write down right now, the ilium in the pelvis is ILIUM. The ilium in the small intestine is ILEUM. Good learning moment there. It's not me being mean.
There's a lot
I'm
of
trying
angry
to train
scribbling.
y'all to pay attention.
That was a lot of angry scribbling. I just heard.
I saw the ferocity of those notes. It's intense. You're a roast.
Now, I'm just gonna
Mr.
call you back
Shannon.
until it turns up the air.
Huh?
I'm just gonna call you back until it turns up the air.
Yeah.
Don't turn on the heat, but turn up the air.
I think I had hypothermia last night. Please don't.
He's like, my toes are blue.
All right, so show you a few what some of these injuries will look like in the pelvis, guys. Classic injury right here, dislocated femur. Out of the acetabulum, you can really see the acetabulum there. How do they fix that? They have to just pop it back into place. It makes a nice, sickening, wet crunch noise too. Yeah. You ever seen them put something back in place?
Yeah.
It makes a really nasty noise. I hate it. I hate it.
So is the pubic symphysis messed up too? Yeah. Cause it looks like
It's starting to separate, yes. Male or female pelvis? And how do we know that?
Outlet.
Obtuse angle on the outlet. Very good.
I have a picture of or like I have a thing from last Thursday of a 13-year-old girl. I don't know what was wrong with her. She had a really crazy limp though. But we did the hip.
Yeah, I've seen crazy stuff where people like they walk around with these things dislocated. I don't even know how that's possible.
There was something wrong with her femur. Like
Yeah.
it wasn't developed properly.
This is an example of a hip replacement, by the way. Very common surgery. They do become dislocated as well, as you can see right here. One thing to keep in mind when we get these kind of x-rays, and you will get quite a few of these at Paraself, you always do what with this type of x-rays? You make an adjustment because you have to do what?
You open the collimation,
You open the collimation, why?
so you don't miss any hardware.
You gotta include the entire hardware. So if you have a hip x-ray coming with hardware, you have to make small adjustments to include the entire hardware. So you wouldn't consider the exact same way. They want to see the entirety of the hardware in one x-ray. Yeah.
On that note, are we still able to comp on
Yeah.
those types of?
Yeah, you
Okay.
can.
You better get it.
I got
Ain't gonna come no
I
more.
was just making sure. Got it.
You know, they hard to come by.
It's still attached.
Some of them is hard to come by.
It's just dislocated.
What you got?
Well, it's
me.
Think about it, you become dislocated, it's still within the skin.
next to him.
There's a lot of tissue there. There is a lot of tissue there. Have you ever seen a hip surgery? Watch how many layers it got cut through right here. It is very thick right here. Even on a skinny person, it's very thick. Yeah.
So, that means they would have to repeat it since they're not getting the.
Yeah, that would need to be repeated because they're missing the hardware over here.
I thought they would just ask for a tib fit or femur instead.
Don't abuse yourself. It's
The-
all right. No self-harming in this class. That's a very good drawing, by the way.
So would they just ask the doctor to order another femur instead, or?
So it would probably be better to order femur series on this. Yes. Yes.
Will it say that, you know, you're taking the x-ray to see the hardware?
Yeah. It usually it'll say include all hardware.
Oh, okay.
Yeah.
What do you mean by the hardware, sir?
That's the actual implants. We call that hardware as well. Hip implants. So you probably some of you in surgery have seen this done right here. When you have a very fractured, comminuted fracture like this, guys, where they gotta get the pieces together. How? By running these rods through the femur. Very long, complex, aggravating surgeries because you won't believe how many times they miss getting these lined up correctly. It's very, very complex. It's also why we are so good as X-ray techs with C-arms. So those are quite common. Look at that injury. Like I said, a lot of car wrecks.
Oh.
You'll see that separation of pubic symphysis, as you
Ooh,
can
got
imagine,
me
extraordinarily
hurt.
painful.
Sure.
Yes.
On that last image, I'm sorry to go back, but the is that fog caused by the hardware or by the osteophytes and stuff like that?
So the fog,
Yeah, in the
it's just
reverse
a,
image.
it's just a bad quality image transfer on my part. That's just a low quality image.
Okay.
Yeah. Yeah, very common injury there, guys. Pubic symphysis being separated. As you can imagine, very painful. What is that, male or female? Can you tell?
I'm gonna say a male.
I would say, like, it's
On your TV screen.
Male, male. Yeah.
Male.
It's male because of the toxic and
Yes. It's called a penis, yes.
So
It's soft tissue.
point to the
But
fracture.
if that was culminated off, hey, we're in science class, it's all right. If you were looking at the actual outlet though, guys, you can still see it's very sharp.
It's on the right
So
side.
it's separated.
The fracture's pointing to the left, so it's pointing to the left.
I kind of look for the heart. I
Look.
still look at.
The heart.
Yeah, I kind of look at it. I'm trying to look at it. Oh.
Another example there, guys. Separated. Well, actually, that's not the pubic symphysis. That's the rami. The rami are fractured too right here.
Wow, that hurts. I know that.
What do y'all see behind the patient?
Poop.
Well, yes, but
Oh.
where are these holes? Y'all see those?
Oh, pants.
No.
Artifacts.
The bed? Oh, that is
The backboard?
It's the slide board.
Oh.
Really good. This is a trauma X-ray with a radiolucent slide board on the patient.
Oh.
very radio or something.
Well,
Have you seen the sea
it's
collars
not
yet?
these artifacts.
They have like a window. It's really cool.
Male or female patient?
Female.
That'd be a female, correct. And that's how they fix that, by the way. If there's ever a fracture of that area, intense amount of hardware, as you can see.
Oh my
you
gosh.
wire it all together. Patient's going to be in recovery for a long time from those types of injuries. Everything infused that back together.
Ooh, they take that off eventually or it stays forever?
I think most people keep that in there.
So,
Oh.
you can have kids with
I know I have to take like 3 years off work because. Ooh.
No, I saw so many x-rays when I was in bone clinic.
Look at this separation.
Oh man, he out.
Are you sure? Are you sure?
Severe separation.
He out of there.
Dang, he's looking at it.
Quite obvious. But yeah, that's complete separation of that joint.
Oh my
As you imagine,
god.
extraordinarily painful.
You just pulled him apart? Like, what happened here?
Usually it's car wrecks that cause that, most commonly.
Y'all better drive more careful.
Now on that subject, I have to talk about this because I get asked this every year because you always have texts that bring this up. Have y'all heard about the John Thomas sign for text yet?
Mr. Funk talked about it. He didn't call it that, but I know what you're talking about.
So this is actually a myth and not scientifically accurate, but most texts will tell you, they even told me when I was in school, that for male patients, the penis will point in the direction of the leg or hip injury.
Oh,
Now, funny enough, that does seem to occur a lot, but there's no scientific proof of that. And there are articles, as you can see, I did a lot of research on it, I get asked it every year. But not a scientifically accurate thing that happens, but you'll notice it happening a lot.
I don't know, it looks like it's going that
It almost
way.
always does, but it's not considered scientifically accurate. And they have actual research articles I looked up on it out of curiosity. But that's what we call the John Thomas sign. Actually, has a name.
Just a statistic.
What's that YouTube video for?
Huh?
That YouTube look?
I don't know what that is.
Do you want to look it up for us, Jones?
I'm not gonna type the whole thing.
Rock report.
I can't remember what that YouTube link is. Oh, perfect. That's where I wanted to stop today. Excellent. So that wraps up the anatomy section.